gain if you compare that to losing control of your leg.
All right. Very important practice. Very, very common for such conditions. Chiropractors. Please make a long statement and advise us or educate us before I get the question to you from YouTube. Chiropractors. What do you have to tell us?
Yeah, I mean it's a very sensitive area, so I'll try and be very diplomatic about that.
Yeah.
And they are everywhere now. Different people opening up and professing to have some sort of treatment that can either cure it completely. You see, in life, when someone says that it has something that can cure you completely, even science doesn't usually say that. So when everybody's marketing something, it says completely, I mean, you begin to raise red flags. All right. I don't begrudge them. I mean, they have some, I'm not too knowledgeable about what they do. But one thing I find interesting is this thing about setting your spine. I'm sure you've seen people go lie on a chair and somebody says they are setting their spine or rearranging it. It's very dangerous. As for that one, I have to say, because I mean, how are you setting the spine? And the spine, it's so delicate. The spinal cord is so delicate that if you go and do one of those things and you're not lucky, and the spine bones shift, and it presses your spinal cord, that's it. I mean, depending on which level of the spinal cord it shifts, shifted, you're in big trouble. And so it's a difficult thing. I don't want to make categorical statement, but with that back setting thing, I can categorically say it's very dangerous. It's not going to give you any relief. People go there, they do that thing, create the noise. It's just a sensationalism. It's very dangerous because you can go and compress your spinal cord and that will be big trouble. If you are going for some sort of a massage, they are massaging your back and all of, because I know some of them do that. So far as it's not any aggressive massage, I mentioned massaging as part of the management. So massaging does help. So if you're going to a chiropractor for a very nice, gentle heat massage or something like that, it helps. But some procedures such as the setting of the back and all, they can be a bit dangerous.
All right, then let me go to the question that somebody asked on YouTube. It's asking, is it good to turn so much that you get the crack sound at your neck or back to feel relief when you feel tired?
There are people so that's what some of the chiropractors try to do. Yeah. I mean, there are people who are able to even crack their neck, once in a while, relieve. It's just like cracking your knuckles. I mean, I would just advise that you be gentle about it, because the part of the spinal cord around your neck, if your spine bone moves and it compresses it, you're going to lose control from your neck down, and it's a debilitating condition to have. So you in cracking your neck, well, once it's gentle, nothing too aggressive. If it helps, fine. I mean, gentle ones. I don't think it does produce so much relief. I mean, you can just rather get a gentle massage of the back of your neck, and it should be able to give you that relief. All right. But let's treat our spines with a lot of dignity, because if you mess up around your spine, that's it. You're gone. I mean, you're going to have a very slow death, and it's serious.
Yeah. Thank you very much. Somebody is also asking, same person is asking, what advice will you give midwives and farmers who bend for so long in their line of duty?
Yeah. Yes. So one of the professions that have a lot of the back pain, young people, is nurses. And not just nurses, all health workers, and then bankers, or not bank, but people who work behind the computer for so long, people who are the teller for so long, farmers and all of that. You cannot say you're stopping your work and how would you feed yourself? You can't do that. And so you put in some of the measures we've talked about. So if your work, you sit a while, you sit well, get a good seat to sit on. You do your work for a while, you stretch a little bit. When you go home, get a good mattress to rest on. Once in a while, get a gentle massage of your back to help relax the muscles. These are the things that help. A lot of the nurses, especially the midwives, because of delivering and all of that, most of them will get the disc prolapse and all of that. So try and take good care of your back. So it's a conscious effort that you need to make. You sit for a while, you stand for a while, you stretch for a while, you get a good mattress to sleep on at the end of the day. These are the things that would help. And once you start experiencing the pain, try and then see somebody as soon as, I mean, a specialist as soon